Hi, so this is the demonstration of the FUE donor scar. So we harvest throughout the back like this, dot dot dot. So the FUE scar is there, and no surgery without scar, but the FUE scar is harder to see. And this we shave with a clipper without a gar, and as you can see, it's very hard to see. Where the strip method will leave you a linear scar, and the strip method, the scar is more visible. So the FUE scar, the FUE, there's always pro and con for both FUE and FUT. The benefit of the FUE is not just less visible scar, but it's less invasive because we're not cutting you open. That means less painful during recovery, less chance of infection. It recovers faster, but the downside of FUE, the cost is more expensive, and then the number of grafts we do is less. You pay more for the FUE because it's the labor, and then the number of grafts we can do is around 25 to 3,000, although there are days we can go beyond 3,000. I've done 35 to 38 before, but it's pretty rare. On average, it's around 25 to 3,000 grafts. So the FUE is more expensive, a little bit less number of grafts, where the strip method you can go 4,000 to 6,000 grafts. The other downside of the FUE is the growth rate. Now, you can have excellent growth rate with the FUE and the FUT, but if you compare my FUE to my FUT, the FUE growth rate is 5 to 10% less. On the other hand, the strip method will leave you a linear scar and it's permanent for the rest of your life. The strip method is more visible if you shave your head short, but you leave the hair long, no one see it. The other downside of the strip method is because we had to cut out the strip. That means it's a little bit more invasive than the FUE. But the strip itself and the FUE are both minimally invasive, and that's why we do outpatient go home. So the strip method is a little bit more invasive, more painful during recovery, and more chance of infection, but it's minimal. It's very rare to get it, and you can give antibiotic prophylactics too. But the benefit of the strip is cheaper than the FUE, and the number of grafts we can do is more, and it's very effective for advanced hair loss. So if you class 5, 6, or 7, quite a bit of people opt for the strip method. Why? Because you can harvest 4, 5, or 6,000 grafts per day, and you feel front toward the back, and you reach your goal faster. And the growth rate of the FUE and the FUT, the FUT or the FUSS or the strip method, it's grow 5 to 10% better density than the FUE. Again, I perform both FUE and FUT. You will have excellent growth rate and density with my work with the FUE and FUT, but if you compare my FUT with my FUE, my FUT or FUSS or the strip method will grow 5 to 10% better density. Anyway, this is the demonstration of the FUE donor scar, and again, I perform both FUE and FUT. Both surgery leave scar, and we can give you excellent growth rate with both.